Hi everyone, welcome back to another episode of the Golden Nuggets podcast. Next to me, I have Ame Bashiruddin, who is the host of the show.
Yo.
And as usual, we always have a special guest. But today's
Yes.
guest is a profile that you've never seen before.
Yep.
Right? She may not be wearing a hat today, but she is a woman of many hats. She is a metabolism coach. Did I get it right?
Close, metabolic health coach. I'll take it.
Okay. And also, she is running a podcast
Mhm.
and is currently writing a book. And I present to you Amanda Lim.
Hey, hi guys.
All
Thank you
right.
so much for having me today.
No problem. So, Amanda, for our listeners who don't know you, can you share a bit more about yourself? Who is Amanda Lim?
Yeah, who is Amanda Lim?
Yeah.
A woman of many hats. Thank you. No, I would say at my heart, right? The first thing I always say is I am a mother.
Mhm.
So I don't. The term mumpreneur doesn't bother me. I think it's cute. It's
Yeah.
totally cool. But I am an entrepreneur. I've always kind of worked for myself, built my own businesses, and those businesses have always been around fitness.
Okay.
So, fitness, I always say there's kind of two ways to get into fitness,
Uh-huh.
right? One is you yourself have had some sort of transformative journey,
Yeah.
right? You've gone on a weight loss journey, you've gone on some sort of, health and medical journey. Or the option, which is me,
Uh-huh.
is you're a lifelong athlete. This has been something that you've done your entire life. And that
Okay.
is really more the path that I followed. So
Okay.
born into an athletic family, been an athlete my entire life.
Mm.
Did go, back to school for some extended academics.
Uh-huh.
Really loved academia. Thought I would be there forever,
Okay.
to be honest with
Okay.
you. But once I started learning more and more about metabolic health and about particularly how to work, with folks with metabolic conditions,
Uh-huh.
I was like, I want to be working with them.
Uh-huh.
I don't want to learn about them. I mean, I do want to learn about them, but I want to be working in the community with
Okay.
folks that need this knowledge. And so
Ah.
that's how I kind of came into the profession of health rather
Okay.
than just kind of the research of health.
So when you mentioned you were an athlete, like what sports did your family were into, and what were you doing?
Yeah. So my parents are both just naturally athletic.
Okay.
And my dad's still to this. So my dad's 76
Okay.
and he still runs 5Ks every other
Wow.
day.
Wow.
So either 3 times a week or 4 times a week, depending on the day,
Uh-huh.
right? So my dad's just always been into exercise.
Mhm.
My mom, not into it at all, to
Yeah.
be honest with you,
Okay.
not into exercise, naturally fit.
Okay.
My dad always tells this story of when they were first dating
Yeah.
and they were just like hanging out on the beach. And my dad was like, "Hey, I'll race you." And my mom just smoked him, just gunned him. And he was like, "Whoa." It's just like, I did not see that.
For real?
coming.
Is this like a true
True
story?
story. True story. Yeah, yeah. She just like, my mom's just like naturally super athletic. Just
Okay.
like, so I will, I accept the genes and I appreciate them. My first sport, my first love was
Okay.
gymnastics.
Okay.
So that was
Mm.
kind of how I came up in sports.
Uh-huh.
And that was really my first kind of taste of serious athletics.
Yeah.
Where you're actually training for something. You're not just like
Uh-huh.
attending a class or attending a game.
Okay.
But I got injured. So that ended my gymnastics
At
career.
which age were you injured?
12.
Oh, that was pretty
Yeah,
early.
yeah, super early. And that's
Okay.
the unfortunate part is that
Uh-huh.
I do feel like I was still developing
Yeah.
to some degree.
Yeah.
And it was a pretty big injury, dismount injury, which is
Okay.
like, you never want that because it's like
Uh-huh.
the impact one,
Uh-huh.
not just like the muscular one.
Yeah.
So anywho, then I was like, hey, what is gymnastics,
Yeah.
but without the impact?
Mm.
Diving. So then I got into springboard
Okay.
diving and I was like, I can still flip and twist and do the things,
Yeah.
but all I'm hitting is water.
Yeah.
So I did that through high school.
Okay.
And then after high school, went to college and just got drunk for a few years. So my athletics were on hold at that time.
Yeah. Yeah.
And again, thanks for the genetics again, because I think that carried me through those genes.
Okay.
And then after college, got really into the triathlon marathon world and the endurance sports world. And that
Okay.
was a huge passion of mine for a long time.
Okay.
Until again, more and more I learned about health,
Yeah.
metabolism, women's health in particular.
Okay.
I was like, I got to pick up some weights, get some
Okay.
muscle on the old frame,
Yeah.
and I think this is going to be the future for what is truly healthy. And thank goodness I was right. So got into CrossFit, weightlifting, that kind of world. And that's pretty much where I am today.
And how long have you been doing like CrossFit and weightlifting?
Oh, this is, I always hate telling people this, because you think I'd be better by now,
Uh-huh.
but I did start CrossFit in 2009.
Oh, that
So
was pretty early.
yeah, right?
Yeah.
Shouldn't I be bigger and better? But here we
Uh,
are. And I will say I took, it wasn't like I was like competitive CrossFitter from 2009 to present.
Yeah.
Definitely not. I had all the babies, so there was like some
Yeah,
pause
of course.
in there. And again, I got really into kind of traditional weightlifting, which
Mhm.
is amazing for
Yeah.
anyone
Mhm.
who's not done it. It's a superb way to get muscles without breaking yourself.
Okay.
CrossFit's pretty
Yeah.
high intensity,
intense,
a lot
yeah.
of gymnastics
And
in
also
there,
impact,
a
right?
lot of impact,
Yeah.
a lot of, danger. And I say that like not to scare people, but meaning like skills development
Yep.
is comes with risks.
Uh-huh.
You're walking on your hands, you fall over.
Yeah.
Like
Yeah, of course.
these things happen.
Mhm.
So yeah, traditional weightlifting is such a safe and wonderful sport that I think I'll probably end up there eventually.
Mhm.
Okay.
But I'm trying to be in that CrossFit world right now.
Okay.
Okay.
Going back there.
Yeah, exactly. Yeah. Like again, I'm really just counting on my age.
Yeah.
I was just like, the older I get,
Uh-huh.
as long as like I can still do the things,
Mhm.
there's fewer and fewer people doing the things.
Yeah.
So
Mhm.
like I think 75, like you will see me at the games. And sponsors welcome.
Shout out.
Okay.
Shout
Okay.
out.
It's an interesting journey, but we go back to what you were studying back then. Like,
Mm.
did you study like sports science, medicine or anything like that?
Yeah, great question. So my first master's degree was in post-secondary administration, which is basically college administration.
Okay.
And I thought at that time that I'd be the dean of a university. Like
Yeah.
that's really where I thought I was going, that I
Uh-huh.
would be, in charge of academics, curriculum, that type of thing.
Mm.
But I, still had this kind of idea that there was some way to better get into health and fitness
Yeah.
through academia. So
Okay.
I went back to school and I started my PhD in sociology.
Ah.
And so I was doing the specialty of medical sociology.
Okay.
And so it was through that I wrote my thesis on women and obesity and kind of what are the determinants of
Okay.
obesity outside of what we know in the health determinants.
Yeah.
So what are the socioeconomic, what are the biopsychosocial
Okay.
determinants of obesity, and
Okay.
are they unique to women?
Okay.
And that's when I really got into looking at this as a field of study. I did not finish my PhD. So for
Okay.
those of you who are wondering, it's like she started a PhD, but she ain't a
But
doctor.
did you finish your thesis?
I finished my thesis.
Okay.
Yes. So I finished my master's degree,
Yeah.
took the thesis, and went into business.
Okay.
I was like, I'm going now. I want to hit the ground running now with this, because it became such a passion for me, like I said, to be in that community with those women
Yeah.
that needed that information.
Okay. I mean, when you talk about socioeconomic status, I think it's quite, maybe it's something that I observe. When you are at the lower socioeconomic status, it's high likely that you will be obese. Would you agree to that?
Yeah, absolutely. I would say that was our strongest finding, as a
Okay.
matter of fact. So the highest correlates of being, and to be a little bit clearer on the research itself, I was looking at correlates of morbid obesity.
Okay.
So morbid obesity, we don't really use that term anymore, but in 2009 we did. It means a BMI of 40 or greater.
Uh-huh.
So my argument was there are independent correlates with this level of obesity that are not just amplifications of lower levels. So it's
Yeah.
not just like the things that make you overweight, BMI 26, you just do more of that or worse of that, and then you become morbidly obese. No.
Okay.
I argue that there were unique
Uh-huh.
correlates with this specific level of obesity, SES being absolutely the strongest. Ethnicity was correlated in the US as well, particularly Black ethnicity.
Yeah.
As well as having 3 or more children. And I thought that was absolutely remarkable, because it was like 3 or more children,
Yeah.
not just like having a child,
Yeah.
but once you are multi-parous to that level,
Uh-huh.
that actually can increase your chances of reaching this high obesity status. And it makes sense.
Yeah.
And, what would be the reasons that someone would have a BMI above 40?
Yeah.
And, the 3 things that came up in my research in 2009, and this was using the N. Haynes data from 1998 and the follow-up 2003 data.
Okay.
So not data that's relevant now,
Yeah.
unfortunately.
Okay.
But anywho, the three correlates of BMI over 40 that were significant, that were not significant at BMI levels of 30 or 25 were low SES. And again, that was at that time below 30,000 US dollars annual income.
Okay.
So that was the level that was considered low. And then Black ethnicity as
Okay.
well as Hispanic ethnicity.
Okay.
This is in the United States. And then the third was having 3 or more children.
Mm.
And what's interesting, right, is like me looking at this data in 2007 and 2009, which is when I was doing the research.
Yeah.
It's like I didn't even have I knew what kids were,
Yeah.
but I didn't fathom like what the female body really goes
Goes through.
through.
Goes through, yeah.
Now that I have the wisdom of that experience with
Uh-huh.
my 3 kids,
Yeah.
looking back, I could absolutely see
Okay.
how one of them
Mm.
could propel you into obesity. You know, I mean, it's like it's no secret that having babies makes it harder to lose weight and makes it more likely that you will in fact gain weight.
Okay.
And each baby, there's weight gain,
Yeah.
you know, that compounds and all that. But anyway, that, like I said, that research is now old, unfortunately.
Yeah.
But doing that research, being in that world,
Uh-huh.
made me think like, okay, if we know
Yeah.
Mhm.
what is unique to this very severe health condition,
Uh-huh.
Yeah.
then we should be addressing this. We should be working on programs and resources for women who need
Yeah.
this information or need support. And that's,
Yes.
again, back to the, you know, not knowing what it was like to have 3 kids and why you would be obese from that thing.
Uh-huh.
It's like the support, man.
So the question is why? Why each kid will make it easier for women to actually gain weight?
Yeah, I think a bunch of reasons, right? I mean, pregnancy itself,
Yeah, of
you know,
course,
is an anabolic period, right? You're going to put on weight, you're going to put on fat. Ideally, you'll put on some muscle, and I argue in my upcoming book that you can definitely put on some muscle if you're trying.
Mhm.
But yeah, there's the pregnancy weight itself.
Mm.
There's, you know, for women who go through postpartum depression issues,
yes,
right? It's
yeah.
much harder to prioritize exercise, healthy eating, healthy sleeping when you are not yourself,
Yes,
you
that's
know,
true.
after the baby.
Mm.
And again, not that every woman suffers that, but many do.
Yeah.
And then thirdly, it's like if you haven't lost the weight from your previous baby and you get pregnant again, and that's, you know,
It's
a decision
compounding.
that,
Yeah,
yeah,
it just
you're
piles
making,
on, yeah.
it just piles on and you're making decisions in multiple planes, right?
Yeah.
If only you
Mm.
were making decisions for only yourself and only your best health,
Uh-huh.
but you're making decisions for your family. You're making decisions for your fertility.
Uh-huh.
Can you
True.
wait another 5 years to have a baby, or can you not afford that if you're an
Mm.
old mom? You know,
Yeah.
so it's like, you know, there's so many decisions that you have to make, and I can understand why the compound effect of those
Mhm.
decisions
Yeah.
would make women, you know, have fall into this category of BMI 40 or above.
Okay.
And again, I think the main distinction there is support.
Yeah.
These women need support. They need childcare.
Yeah.
They need somebody to be able to take the burden off of them so they can exercise, you know, so they can get a healthy meal cooked for themselves. You
Yes,
know,
that's
it's
true.
like the resources and the support is massive. And like I said, that doing that thesis was the first time that I could really understand why that might be a factor.
Okay, but how do you actually cope with your 3 children?
Yeah.
Like-
yeah. How do I cope with those guys?
Do you have
Those crazy a-holes. No, I will say, you know, being in Singapore,
Yeah.
thank goodness,
Uh-huh.
we do have access to affordable childcare
Okay.
in the form of our
Mm.
live-in helper.
Mhm.
So my live-in helper,
Okay.
I always say, is my right hand man. She's a CFO, right? She's
Yeah.
she's a chief family officer. She's there holding it down
Yeah.
so that my husband and I can hold down the things that we need to do as well.
Okay.
You know, but I will also say in Singapore, where
Yeah.
we do all have helpers,
Yes.
it's not like everyone is super fit and exercising all
True.
the time either. So
Yeah.
you
Yeah.
can, just like with anything,
Yeah.
you can execute those resources
Yeah.
however you want. So if you want to execute them so that you can get to the gym,
Mhm.
great.
Yeah.
If you want to execute them, you can like chill on your couch and scroll your phone while somebody's making food for your kids, you can also do that. Right. So you still got to make the choices no matter the resources that you have. So I'm
Okay.
all about trying to, you know, empower women to employ the resources they have
Yeah.
in the ways that get the outcomes that they want.
Okay. So I mean talking about that, right? Like some people, because they need the helper, they tend to work more because it goes back to lower SES, right?
Yes.
So they need to hustle more, they need to take up
Yes.
like extra jobs. So how does one actually resolve this issue?
Yeah. And hey, there are 2 resources,
Uh-huh.
time and money.
Yeah.
Time and money. And at a certain point, you know, you're going to have to make a trade on one to get the other, unless, you know, you've really nailed like, you know, your investment portfolio or whatever it may be, right? Where money is somehow making itself without time.
Yeah.
Mhm.
You know, so I would say really time is the biggest resource because money in theory can be made, but you can't get time back.
Yes, that's true.
Yes.
And so I will say, you know, for people that are really busy, burning both ends of the candle,
Yeah.
working hard, got kids, you do the best you can. And that's where I think nutrition actually becomes your strongest player. Because if you don't have the time to devote to exercise, I hear you. Like I hear you. And you know, hopefully in the future you would, your kids get older, whatever.
Yeah.
But we all got to eat.
Mhm.
So those choices are within your control. So if you're someone who's trying to make a healthier, you know, lifestyle, body, mind, whatever,
Yeah.
the thing that is most under your control is what you put in your mouth. And that takes, you know, we all have time
Yes.
for that, whatever it may be.
Yeah. So what you are suggesting is we can actually perhaps advocate to the helpers that we have at home to cook for us a better and healthier meal.
There you go.
Uh-huh.
Again, you
And
want
shop for
to
the healthier
healthier
things.
foods.
Yeah.
Yeah. You want to execute that resource. I mean, again, to the Americans listening to this, they will flip out to think that like someone would be at home cooking you a meal.
Yeah. Okay.
Like even if you're working 14-hour days,
Uh-huh.
the fact that you could get home and a meal would be there is like unimaginable for
Really?
Americans. Who has live-in help in America? Royals, like celebrities, like
Oh, okay.
not regular people ever. So yeah, the idea that someone's just putting a chicken breast on a pan,
Yeah.
like ultimate luxury. Seriously. Again, my brother's listening to this. And like, oh yeah, I wish I had that when my kid was young.
But I mean, is it much more expensive over there to get
more.
helpers?
Way more
Okay.
because it hasn't been an institutionalized structure that we have here. So there's labor laws don't have something that would make that affordable.
Okay.
The rate that you would have to pay a helper to live with you and then the implicit hours there would make it inaccessible.
Wow. It's interesting because I think not many people actually does this study, right? And what were your solutions for this kind of thing aside from finding out how to execute certain things properly?
Yeah. One of my solutions, so this is one of those things, this is why academia will always drive me crazy because it's like you do this research, you do the analysis, and then everyone's conclusions are always like, more study needs to be done on the, because it's like you get out of it, it's like you don't really have to provide solutions because you're like, well, hey, or you point out the flaw, like it's like using BMI as a flawed metric. It's like, yeah, but this problem's still there. You know what I'm saying? Like,
It doesn't
okay,
get
whether,
solved.
it does not get solved. But what I will say, something that I did call for, and that like I said, I still very much believe, is that if we can't get individual support to these women, so meaning they can't afford a personal trainer, for example, they can't afford a live-in helper, again, in the US, impossible. Can we get community or pooled resources?
Okay.
So meaning, for example, can we get these women that have multiple children? Can we get a community center that runs a fitness program where childcare would be present?
That's interesting.
So you bring your kids, there's somebody there to watch them for that hour, and there's a fitness professional there to take you through a workout for an hour. So you're getting the support that you need, the direction that you need, right? And then your kids are also getting watched. And again, a community center would have the resources to do that. It's two people. You could get a teenager to watch the kids, like a babysitter. It doesn't have to be like some Montessori educator. Like just get somebody to watch those children, and then a fitness professional, potentially someone that's new starting out, wants a gig, get them there. It's a matter of making it a priority, and like I said, pooling resources where maybe individual resources would be out of reach.
So as an academic, right? How do you think resolving the ongoing or perhaps the increasing obesity rate in Singapore, especially, whether it's in the US or in Singapore, how do you think it will affect the country as a whole?
Yeah. Oh, well, I mean, what I love about it, I would say the number one thing I love about Singapore is my husband, my family. Okay. Number two thing is safety. Number three, though, is really like 2A, is how involved and invested the government is in the health of its citizens.
Okay.
They put money where their mouth is. This is not a government that does talking head. Like they actually try. And I'm not saying they're perfect because there's a lot of things that Singapore could do better. But when it comes to health, they're trying to do the Nutri-Grade, for example, on
the
sugar,
ActiveSG.
the ActiveSG. We all get ActiveSG credits in our pocket to use for the local gyms here. The public gyms here. We have access to healthier choices at the hawkers now with the little healthier choices pyramid. So at least you can direct yourself to a healthier choice. Like they really try some of these like population level health interventions, and I love it. Where I think they could do better is in and again, the public health people are going to roll their eyes at me. I'm thinking of one of our friends, Elliot. He's like, "Oh, great, okay, Amanda, you live in the clouds," but I wish there was a little bit more education around the role of muscle in metabolic disease. So yes, decreasing sugar, great,
Yeah.
right? But also having places to store your sugar in your body,
Yeah.
also great.
Yep.
Meaning like the things that you can do to reduce your glycemic load in addition to the foods that you're putting in your body. So I'm saying like you can make substantive changes to your body composition that make you a more metabolically healthy vessel. And I don't know that Singapore has they don't communicate that very
Yes.
well.
Yeah.
That you can take a bit more charge of your health from a body composition
Yeah.
standpoint. Again, I know that public health cannot do it all
Yeah.
in that regard. And so the lower hanging fruit is like, hey, eat less sugar. And that's also correct.
Yeah.
So it's like, I respect what they're doing, but I think the messaging around, and again, particularly for women,
Yeah.
is like, you could actually, so here's an interesting fun fact. My husband and I, we're out a lot of like metabolic health talks and stuff with
Yep.
different doctors. And one that he was on during one of his programs was talking about how many women in Singapore meet the minimum criteria, the 50th percentile for muscle mass. And what was interesting is in their 20s, it was like 46%.
Okay,
Okay.
that's quite bad already.
If okay, let's say okay. I mean, again, still not good.
Yeah.
Yeah.
In their 40s, it was like 38%. So less,
Yeah.
which is not surprising because aging.
Yeah.
But in the 30 to 39 age group, it was like 27%, the lowest
Yeah.
of all.
Uh-huh.
So you're thinking, wait, if it's an aging thing,
Yeah.
then 40 should be lower than 30.
Yeah.
Yes.
No,
Yeah.
because women in their 30s are the ones having babies.
Okay.
And they are not
Oh.
exercising in their
Enough.
pregnancies.
Yeah,
They're not
yeah.
exercising after their pregnancies,
Uh-huh.
and they're losing muscle at an alarming
yeah.
rate
Mm.
during that time. And if you look at the gestational diabetes rates here,
Mm,
which
yes,
are,
it's
by
very
the way,
high.
a window into type 2 diabetes.
Yep.
You don't get gestational diabetes and then you're free from diabetes.
Yes, I
You
agree.
get gestational diabetes and you're
And
looking at
then-
diabetes
yeah,
down the
yeah.
road,
Yes.
So it's like this is a problem that definitely is dietary. And again, Singapore is doing amazing at
Yeah.
addressing it, but it's also a problem of being under muscled
Mm.
and not getting the proper information about muscle building exercise. So I feel like that's where they can do better.
Okay. I mean, I may sound like a conspiracy theorist, right? But I guess certain things are not advocated because if that's the case, they cannot earn through our healthcare system, right?
Facts. And you're talking to someone in their healthcare system. My husband and I run Lift Clinic, which is a specialty metabolic health private clinic.
Uh-huh.
Yeah.
But
Okay.
he also runs a chain of GP clinics.
Okay.
So that's
Okay.
like another part of the gig. And so we see GP
Mm.
clientele, right?
Yeah.
We see, similar clientele to what you see at the polyclinic.
Yeah.
And you're absolutely right. You
Mm.
want to make a buck.
Yeah.
Prescribe insulin, prescribe
Exactly.
metformin, prescribe GLP-1 now. It's like, you want to make a buck? It's medicine.
Yeah.
It's not preventive care.
Yeah.
Get out of town. So I hear you.
Yeah. But yeah, I mean it's sensitive, but me not really being in healthcare anymore, I think I can safely say it, right?
Yeah.
Yeah, but I think if your husband were to say it, I think it's not really good for
not,
him.
No, and hey, not sensitive at all. I mean, because again, the GP machine, the polyclinic
Yeah.
machine, it's going to keep on running. So
Yeah.
we're not going to
Yeah.
like break it down with this podcast. But what I will say is, so here's a fun fact, right?
Uh-huh.
So we're private,
Yeah,
but we still get drug reps coming in.
of course.
Yeah.
And we got one coming in last week, and I won't say who, but I'll
Mm.
describe the products, and
Okay.
you can make your own conclusion. They come in with a blue bag,
Okay.
full of meal supplements.
Okay.
Meal replacements.
Okay.
Meal
Okay.
replacements. And there's one marketed to the diabetics,
Uh-huh.
and there's one marketed to the elderly, and then there's a third marketed just for your average person trying to lose weight.
Uh-huh.
And these things are chock full of carbohydrates,
Uh-huh.
sugars,
Uh-huh.
and a bunch of BS ingredients
Uh-huh.
and protein, by the way, was like single digit. Let's just put it that way.
Does the
Single
company
digit.
start with A?
Yes, it does. Yes, it
Okay, I
does.
know which one.
Yes, it's a company in Singapore, which I will not know. But they come in here with this bag of crap, and my husband's like, "We're not ever going to give that to our patient. Like this is like you're barking so far up the wrong
Yeah.
tree."
Yeah.
And this guy comes back at my husband, and he's like, "We have RCT evidence that show that these products help people lose weight." Yeah, bro.
Yeah.
Because if you replace, first of all, the
The
RCT
balls on this
evidence.
guy.
Yeah. Oh, no. I mean, it was, and I wish you guys knew my husband. He's like the least confrontational human being that exists. So he would never like argue, he just like, yeah, whatever.
Yeah.
But the RCT that they were referring to
Uh-huh.
was on hospitalized,
Mm.
bedridden,
Mm.
elderly men.
Okay.
And they went on this meal replacement of 2 shakes, and then they were able to, lose weight and preserve muscle mass.
Mm.
Well, yeah, not hard to, you can preserve muscle mass on 20 grams of protein because you're not moving
Yeah.
and you're, anyway. So yeah, so my husband was like, yeah, we'll take your samples and we'll put them in the garbage can. They're like, oh, just, have a look at the labels after we leave. So we did. And yeah. But point being, yeah, it's dude, it's a racket. Exactly what you said. It's a racket.
Yeah.
They're out there to make money and
Yeah.
sell. If they can't sell, their idea, I guess, of preventative health is selling these supplements.
Yeah.
These meal replacements. It's like,
Yeah. Yeah. I mean, like, ultimately, they are one of the biggest paymaster for our economic system, right?
Fair.
So while we can say certain things, at the same time, some people may say that we need them,
yeah,
not because of what they're providing, more of because of the financial support that the economy is actually relying on.
yeah, you're not wrong. You're absolutely not wrong. And again, I think something we all benefit from in Singapore is, the financial situation. The fact that Singapore's got some dollars.
Yeah. So before we end the first part, right? I want to know a bit more about you mentioned about the few things that will actually affect how the obesity rate will actually increase, especially in terms of women, right? And I'm still stuck with the socioeconomic status, like you mentioned 30,000 in the US. That is one of the key indicators. But how can we resolve this? Because socioeconomic status is really beyond our control. Like for example, I don't know if you know, I was a nurse before this, and my salary wasn't that fantastic, and maybe I'm earning like about 40 to 50,000 Singapore dollars, but of course the how expensive it is here, right?
Yeah, over here it's just
The most expensive city in the world, right?
Yes,
exactly.
yeah. So I mean what I'm trying to say is it's something that I cannot solve if I were to still stay in my industry.
Yeah.
So how does one actually resolve this issue in your point of view?
Yeah. Meaning how do they find like resources
to-
to spend
yes.
on
Yeah.
health?
Yeah.
Yeah. I mean, again, unfortunately, the systemic issue is working against you in that case, right? So, for the women in my study, it's the NHANES data. It's this massive data set in the US. And so it's not like it's a few, it's not a study of 20 women, right?
Yeah.
This is a study of thousands. And unfortunately, what we're finding is that, yeah, SES is the strongest correlate. I think, again, the resources are less. So it's a matter of what can we do better with the resources that we do have. And unfortunately, it would be a slower and smaller process, but I do think that it is still possible. So for example, with your previous work, being a nurse, right?
Yeah.
I assume you were on your feet a lot.
Yeah.
So at least you could get steps.
Okay, so of course, I think I shared with you when we were in the Philippines. One of the reasons why it's very difficult for me to lose weight is because I don't sleep, right? But because I was working in one of the biggest hospitals in Singapore, and I was working in the operating theater, which is basically, I think they have like 34 theaters in total. So the number of steps I walk per day can cross 12,000 steps.
Yes.
But I was still having difficulty losing weight.
Because of the sleep.
Yeah, that's one of the issues.
Yeah, sleep and potentially diet, right?
Yeah.
Because obviously the dietary choices that are available at the hospital. I mean, I also I've been to the hospital a few times, and yeah, it's not great.
I mean, what we got is worse. Yeah, it's like some uncooked chicken stuff.
Oh, yeah.
But yeah.
Yeah. I mean, again, I wish I had a better solution for this. I really do. And I think, unfortunately, it's one of those things where if governments can put more money into making sure that healthy options are available in spaces that employ thousands of employees, like hospitals. You think about MBS, right?
Yeah.
The Marina Bay Sands Hotel
Oh, yes,
here. They have that underground
yep.
super kitchen.
I worked there before.
Yeah. So it's like they have access to
Yeah.
healthy food,
Yeah.
or they have at least the choice to choose, whether they choose it or not, but at least it's there. There's a
Yeah.
salad bar there.
Yep. Yep.
You know, you think about Google, right? That's out where I live, right?
Yeah.
And it's like they have this beautiful, overwhelming selection of all
Yeah.
types of foods.
Uh-huh.
They
Yeah.
got free protein shakes they
Yeah.
can grab and go, at any
Ah,
time during the
okay.
day. So it's like, making sure that if corporations and governments
Mm.
can do a little bit more on the back end to support people that are working,
Uh-huh.
Mhm.
I think that's a huge one. And again, back to childcare. If there's more childcare options, particularly for women, that's going to be the big game changer for them,
Mm.
because I think that is what holds a lot of, particularly moms who aren't working, who are in the home,
Yeah.
all day. They can't. There is no opportunity for exercise
Yeah.
other than, like I said, walking, being outside with the kids, which is a good start,
Yep.
Mhm.
but it's not everything.
Mm.
Okay, I think we can take a break. And,
Yeah. I
can-
think this has been a very wonderful and insightful conversation.
Yes.
And I'm pretty sure Amanda has a lot more to share.
Yeah.
But I think
despite the noise.
Yeah, and we truly apologize for the noise. But with that said, we would love to find out more about how you've helped over 1,000 women in part 2. So stay tuned, guys.